Okay, I lost the picture, so I just hi everyone. Good morning, good afternoon. However, it is morning or after midnight in our timing here in Southern California. I am so excited to be with you here and welcome to everyone. I would like to present to you about the resiliency among inpatient Southern California and Hawaii nurses post-COVID-19 pandemic surges. Just would like to disclose that there is no conflict for this study, and there was no funding received specifically for this study. All right, so apologies about this. All right. As we know, COVID-19 pandemic affected nurses' aspect of their well-being, their lives, emotionally, physically, mentally, psychologically, spiritually, personally, and their families and social status. Emerging issues triggered moral distress and outrage, uncertainty and dilemma, suffering, injury and resiliency. Resilient individuals have been shown to more effectively handle stress and anxiety and other mental health issues during the pandemic compared to non-resilient people well. Resilient nurses exhibited and more sustained physiological, emotional, psychological, mental well-being more than the other individuals. So the study is significant, was proposed to boost the nurses' resilience because psychological resilience plays a role in safeguarding nurses' mental health against adversity and can work as a protective factor against consequences of the pandemic on crises, which include stress and anxiety, PTSD, depression, emotional exhaustion, mental fatigue, and sleep disturbances. Burnout is becoming unavoidable among nurses who have been placed in vulnerable situations during the COVID-19 pandemic. As a result, nurses are at risk to leave their position. If this is not addressed, this may lead nurses leave the profession completely. Consequently, nurses turnover might result in worsening the nurses shortage, which is costly and negatively affect delivery and quality of nurses' care. Burnout and turnover among nurses separately or combined compromise patients' care and increase possibility of medical errors. Interventions will be targeted to build nurses' capacity to recover from the COVID-19 pandemic. So the purpose of this study was to describe the nurses' extent or prevalence of resiliency and job satisfaction, examine the relationship between nurses' demographic, resiliency, job satisfaction, burnout, and turnover, explore the mediating effect of resiliency and satisfaction on the relationship between burnout and turnover. As we know that caring for the healthcare care providers could improve the healthcare environment and patients' outcomes. And this is based on the the theory of a human of caring. So the study methodology was cross-sectional, descriptive, correlational mediation study among convenient sample who participated voluntarily in the study in 16 Southern California hospitals within an integrated healthcare system. And the inclusion criteria was that patients who, nurses who are inpatient, working inpatient, and included also nurse directors, nurse managers, nurse educators, APRNs, full-time or part-time or per diem who were working at that time. The procedure happened after the IRB approval, and the nurses were recruited from those 16 medical centers anonymously through a survey monkey. And the data collection actually staggered because of the pandemic and the situation of the medical center at that time. It was intended to be happening at the same time, but because of what was going on in different areas, we had to stagger the data collection. The instruments that were used were, of course, descriptives were collected from those participants. We used the Connor-Davidson Resilience Scale 10. We used the burnout subscale from the ProQual or Professional Quality of Life Scale, and the brief index of effective job satisfaction and over intention to leave scale TIS6, and 4 questions on well-being and turnover that we proposed ourselves. Data included descriptive statistics for the demographics, for the CD risk 10, the BIAJS or the job satisfaction, the burnout, and the TIS or intention to leave. And also correlations were examined, and then there were ANOVAs and t-tests that were performed. However, I'm not going to present those for the time constraints. And then regression analysis also employed. What we have found that from the convenience sample, there was 1,567 participants in this study, which represented 11.7 78% of our nurses in Southern California among the integrated healthcare system. The average age was about 44 years, and that's high. And then it was ranging between 20 to 75 years. The experience, RN experience, also the mean was above 16 years, and it varied between 0 to 47 years of experience. The data collection mostly happened during the height of the pandemic, which is more than 70% was collected during that time. And then 73.4% were clinical nurses versus almost 10% charge nurses. 12% were managers and directors, including the CNEs, which is the hospital supervisors. And as we look further, we can see that almost 61% were full-time, and above 85% were females. Also, almost 61% were BSNs, mostly day shift, and also working 12-hour shifts. In the mid-surge oncology dialysis, it was less participation, but almost similar to telemetry. Most of the nurses who participated were, or 31%, above 30, were Asian or Asian American, and who worked mostly 36 hours, which is full-time. And their experience was middle experience, about 6 to 10 years. And then there were a lot of the participants who were less than 5 years experienced among our integrated healthcare system. Here we can see that this is the table for the correlation table for the 5 variables, which is the resiliency, the burnout, the intention to leave, job satisfaction, and well-being. And we can see that satisfaction and TIS has an inverse relationship, and that is high. And also we can see that there is a positive relationship between well-being and TIS, which is the intention to leave. This is for some demographics with those also variables. I'm not going to go into that, but I'm going to move on to the results of the resiliency. And we can see here that when we looked at the scale, the mean was above 29.51. And then based on the cutoff criteria by the CD risk 10, we can see that most of our nurses are highly resilient, almost like most of our nurses resilient. And then when we looked at the burnout, which is the subscale of the Procwell, the mean was 25.19, and actually the criteria is low, average, and high. So we can see that most of our nurses were average. They have average burnout, so it is like overall 73% of this study participant reported that they have average score of burnout, which is good. And then the job satisfaction, when we looked at that, the mean was 14.25 or 24. And then the cutoff criteria, we can see that mostly that our nurses highly satisfied, about 85% reported high satisfaction. When we looked at the TIS, or intention to leave scale 6, we can see that per the Othoma and Rabot 2013 cutoff criteria, also most of the nurses, about 59%, intend to stay, and that was a great also result. We couldn't establish mediation for the burnout. However, we ran regression, and when we looked at the regression, we can find out that actually the 5 variables combined were able to explain about 65% of the variance in the model, which is great. And when we looked at each one of them, we can see that well-being had the highest of all among all of them. So what are the limitations of the study? Of course, this is a convenience sample. It was self-reported. Only it happened in the year of 2020 of the COVID-19 pandemic. And it does not reflect the perceptions of those who did not complete or participate in the study. Therefore, it is limiting generalizability. So what can we actually glean from the study? How can we apply it among nurses? We can provide focused support to the less experienced nurses to increase their retention, as we can see, and increase awareness, education, and implementation of tailored intervention to increase nurses' satisfaction, specifically among the young generation, because when we looked at the ANOVA, we can see that the young generation are suffering more of burnout and less resiliency. And then recommended assessment of hours worked and advice to have life-work balance of limited work hours, and continue the drive for innovative ways to enhance staffing and resources, and promote tactics to build positive workforce to retain and recruit nurses and mitigate intent to leave. So our recommendation is to promote a supportive, healthy environment to reduce turnover, and maybe have repeated measures studies, and also retain the newer nurses and increase the RN resilience and satisfaction, especially the younger generation. For future research, the results from the study can be used to design an intervention to increase resiliency on intention to leave, and examine the influence on younger, less experienced clinical relief charge nurses, dissatisfaction and intention to change their current position. Implement experimental approaches to promote healthy environment and reduce turnover, and replicate the study post-COVID to study intention to leave triggers among registered nurses. With that said, I will come to the end of this presentation. Those are some references or selected references that we used, and also if you have any questions. This is my team who worked with me on the study. As you can see, this is our nurse scientist. This is also a research and ABP consultant, and our analyst. And I'm sorry they were not able to join me for tonight, but maybe in the future. And at the end, this is my email address if you would like to reach out to me. I am the Director of Nursing Research and Evidence-Based Practice for Southern California, Hawaii at Kaiser Permanente, Southern California, and also the co-chair for the Council of Research and Evidence-Based Practice for Kaiser in the United States of America. Thank you. Any questions? All right.